Welcome to Med Madness, your trusted companion for mastering medical concepts. Today, we delve into a topic that holds significant importance for all medical students: proper breastfeeding techniques. Breastfeeding is not only essential for providing infants with optimal nutrition, but also crucial for maternal comfort and the continuation of breastfeeding over the long term. In this episode, we will explore what proper breastfeeding entails, discuss common issues such as nipple pain and engorgement, and provide guidance on managing these challenges effectively. Let's begin by understanding the fundamentals of this vital practice. Next, let's discuss what proper breastfeeding technique is. Proper breastfeeding technique is essential for both the mother and the infant. It ensures that the baby receives adequate nutrition while minimizing discomfort for the mother. Poor infant positioning and improper latch-on techniques are common culprits behind many breastfeeding difficulties. When an infant is not correctly positioned, it can lead to nipple injury, causing pain and potentially leading to complications such as plugged milk ducts, mastitis, and even breast abscesses. These complications often force mothers to stop breastfeeding prematurely. Therefore, mastering proper breastfeeding technique is paramount to avoid these issues and promote a healthy breastfeeding experience. Moving on, many mothers experience nipple pain during the immediate postpartum period as they adjust to nursing frequently, often 8-12 times a day or more. This pain usually subsides after a few weeks. However, if the pain worsens and persists between feedings, it often indicates nipple injury. On examination, mothers may present with open, linear areolar abrasions, bruising, cracking, and blistering of the nipples. Additionally, breast engorgement can develop, characterized by bilateral, diffusely tender and engorged breasts, especially when nipple pain limits breastfeeding sessions. Next, let's outline the diagnostic methods and tools. Diagnosing issues related to improper breastfeeding techniques primarily involves a thorough observation of the breastfeeding process. Healthcare providers should assess the infant's positioning and latch-on technique. It is also important to identify any signs of nipple injury, such as abrasions, bruising, or blistering. In some cases, imaging techniques like ultrasound may be used to evaluate complications like plugged ducts or abscesses, but the primary focus remains on clinical assessment and patient history. Now, let's describe the treatment options. The initial management of nipple pain and injury involves careful observation and education. Healthcare providers should guide mothers on the correct breastfeeding positions and latch-on techniques. Addressing these foundational issues can significantly reduce nipple pain and prevent further complications. In cases where complications such as plugged ducts or mastitis occur, medical interventions may include antibiotics or drainage procedures for abscesses. Lifestyle modifications such as ensuring regular breastfeeding or pumping to prevent engorgement are also crucial. Preventive measures, including educating mothers before delivery about proper techniques, can help mitigate many of these issues. Let's consider a brief case study to illustrate these points. A new mother, Jane, presents with persistent nipple pain and bloody nipple discharge. Upon examination, she has open, linear abrasions on her areolae and signs of engorgement. Jane's breastfeeding technique is observed, revealing poor infant positioning and an improper latch. After receiving education on correct positioning and latch-on techniques, Jane's nipple pain gradually subsides and her breastfeeding experience improves significantly. This case underscores the importance of proper technique and early intervention to prevent complications. In summary, mastering proper breastfeeding techniques is crucial for ensuring maternal comfort and adequate infant nutrition. Early diagnosis and management of issues such as nipple pain and engorgement can prevent complications and promote long-term breastfeeding success. We encourage our listeners to engage with the pre- and post-podcast quizzes and utilize Anki flashcards for effective study and reinforcement of these concepts. Thank you for tuning in to Med Madness. Stay informed, stay confident, and continue your journey towards medical excellence.